Hey peeps, Amma here. A very warm welcome to my YouTube channel and thank you so much for tuning in. Truly appreciate your support. As you may be aware, the 10th of September was World Suicide Prevention Day, and this month here in South Africa, the month of October, is Mental Health Awareness Month. This shows that mental health is a big deal and people need to spread awareness about it to prevent suicide. And as for Amma and Peeps, we are doing something about this. Hence today I am in conversation with two of my peeps about mental health, illnesses and care. So be sure to watch this video till the end to learn more about this vital topic. Joining me this Saturday is Moagi, who is currently studying a BA honors and she's specializing in psychology. I'm also joined by Khodani Tshikovhele Lucky, who is a PhD candidate specializing in clinical psychology. And Khodani also runs a private clinical psychologist practice called KTL. And yeah, I would really like to know more about this. I'm sure you guys would like to know more about this practice. So we'll talk a bit about this later on. So be sure to watch this video till the end. Martha and Khodani, thank you so much for joining me. I'm so excited to have you.
A pleasure.
Thank you.
Yeah, you're welcome. So you guys are aware today we are talking about mental health, which is a very, very important topic. And I truly appreciate your time for really your willingness actually to talk about this sensitive topic, really. Perhaps one of you can just give us a background. What is mental health and why is it so important to make people aware of it?
Thank you. Mental health. Mental health relates to our emotional, psychosocial, and our social well-being. It has a great effect on our thinking, our feeling, and how we act. It is defined by the World Health Organization as a state of well-being whereby a person can actually realize their abilities and how they deal with the normal stresses of life and how they are productive in the communities that they serve. It is important in all stages of life, from childhood to adolescence and throughout adulthood.
Khodani, do you want to add on what Martha said, just to give a background on what exactly is mental health and why should we spread awareness about it?
I think first of all we need to ask ourselves, what is mental health? What is health in general? If you're sick, you consult with a medical doctor. Same goes with psychologists. If maybe something is wrong or mentally, if maybe there's a broken limb somewhere in your mind, you definitely need to seek professional help. And the psychologists who are trained just like doctors. Doctors study 6 years of the body, I believe, anatomy. So if maybe you have a broken hand, they understand that the whole anatomy part of it.
Yeah.
So psychologists also studied the 6 years of the mind, emotions, and social. We do believe that in this life that we're living, there are millions and millions of conditions that can be diagnosed by clinical psychologists. So, yeah, same as medical help, you also need mental health.
Yeah, absolutely.
So it's good that you're spreading this awareness. People will at least prioritize the importance of seeking mental health.
Yes. What contributes to isn't like the key factors that contributes to mental illnesses? Do you want to share some of the key factors that contributes to mental illnesses?
Okay. There are no really key factors, to be honest, because now we'll be generalizing everything. But I believe that there are main generic factors. Because as individuals we experience life differently, and our perceptions are different when we approach certain problems. So in that, we get predisposed to certain mental illnesses, right? That's when now we talk of biopsychosocial modalities. Talking of bio, we're talking about people who are genetically exposed to mental illnesses, let's say, for instance, schizophrenia or bipolar mood disorder. People with such conditions, they inherit them from their family members, or maybe sometimes, yeah, let's just say family members. Let me not
Like
even
genetic
cut
kind
corners.
of.
Yes. So when we talk of psycho, we're talking about the grooming now, day-to-day experiences,
Yes.
socialization. Let me give you a proper example. Sorry, I'll give lots and lots of examples. Let's
Of
talk of a
course.
family where maybe, yeah, let's talk of a family where maybe a child is growing up with parents walking around naked. To that child, it will be normal. But when the child goes out now to the society, we'll say the
Mm.
child is crazy. But then to him, it was normal. You
Because of
get me
what he
now?
was
That's what we talk
exposed
about.
to.
Exactly, exactly.
That's
So the third one we'll talk of social. Now this way peer pressure in school, that's what we talk about peer socialization and the core beliefs and also triggers that will end up exposing these particular individuals to a mental illness.
ah
So that's what I'm saying. It's not, we can't really say they're key main factors. No, no, no. We can only speak of generic factors that exist out there when an individual is faced with certain life challenges.
yeah, makes sense. Martha, do you want to add? Do you have some? So they're not key factors; they're just generic, which it makes sense. I agree with you why this is the case. Martha, do you want to share some of the generic factors that contributes to people having mental illnesses?
With the generic factors, I think you see them. There'll be a family whereby there's someone who has a long-term mental illness, something like that. Someone has long-term mental illness, and then it is passed on to the next generation, going on. In fact, that there's someone in that family who will inherit from that person.
Mm. Is generic factor? I don't know if I'm on the right track here, but say you just stressed out, and then can this eventually be a mental illness, or it only becomes a mental illness when obviously it's depression? I'm not sure. Do you guys, as specialists in clinical psychology, clarify how does stress in here?
Um, Anything that affects your daily functioning, be it your um, mental sphere, your social sphere, and also your cognitive sphere, qualifies to be a mental illness.
Uh,
When you're with your friends, they are now starting to get a weird vibe about you. Cognitively, you are forgetful, and even your boss is starting to ask questions. And also, emotionally, you always fatigued, always either sad or crying. If those three main factors are affected, that is
hmm.
a mental illness, and you need to be seen by professionals. So, to answer your question, yes, in psychology, there is a theory called CBT, cognitive behavior therapy, where we believe that your thoughts influence your emotions, and your emotions will influence your behavior. And what is behavior? Behavior is a relatively permanent change in your own patterns and of personality, right? So let's say maybe you've got this notion or distorted belief that okay, I'm a bad person, people say I'm a bad person. Then it goes from being a pattern to now your personality and then behavior. Boom, you're gone. One moment we're gonna be treating personality disorders now.
Oh,
So at the end of the day, it begins with the mind where you there's a trait and you nurture that trait and it affects those three spheres.
I
That's
get.
where it qualifies, yes, to answer your question.
Yeah, that's true. Well, I was just looking at the statistics, and research shows that a lot of people that suffer from mental illnesses, they actually don't go for treatment. Why do you think this is the case? Is it because they're not really aware that they have mental illnesses, or because they're just shy or they're scared? I don't know, but can you please just share why are people not going to seek treatment, but then they have mental illnesses?
I think one thing that makes people not to go and seek for mental health care, it is because some people are not aware. They are not aware of what is mental health and how it occurs and its effects. They are not aware that they are having a mental illness.
Yeah.
So that's why we need the awareness, so that people can be aware of what is mental health, how it occurs, what are the effects, and what should you do if you have that kind of a condition.
Yeah.
So, and another thing, I think it's stigma. People have fear of being stigmatized. And some people are in denial. You find that you do have that mental illness, and you know that you do have it, but you're in denial to go and seek help. And then some are afraid of treatment because of that stigma again. So we need to have this mental health illness awareness, so that people can be aware and know when to seek help and how to seek help and where to seek help.
Absolutely. Absolutely. Wow, that's very helpful. How can we how can we prevent this? Maybe Khodani can answer this. How can we prevent this? The whole thing of people going to seek treatment, yet they have mental lessons. How can we make sure that people go for treatment? And also, why is it important to go for treatment?
Okay. Like I said, I'll use lots and lots of analogies and examples. Look at it, what we're doing now. This is awareness. Today, teach one. What do they say? Teach one, each one. Yeah, you are teaching someone today, so they'll know what is mental illness. And also, as Martha said, the stigma kills everyone. And when it comes to medical conditions, and also same with mental illnesses. The example that I'm gonna give, let's look at the whole novel coronavirus now. There are too many conspiracy theories. Some people don't want to take the vaccine. Some people believe that it's from the 5G network and everything. Some people. So, in each and every medical condition or psychiatric condition, there'll always be second thoughts, stigmas, all
Yeah.
those things.
And
So,
hesitate.
awareness.
Yeah.
Exactly. So awareness is the best tool so far. What we're doing, this is how we should do it. Mental health awareness month. So also to add what Martha said, my PhD also focused on the impact of exercise on self-esteem, um, depression, and also anxiety in the University of Venda. Why Venda?
Because there are people that who don't know. If you mention a psychologist, they'll be like, "What the hell is that? Why is that?" Previously, disadvantaged communities. Let's talk of places deep in Venda, like Woforowo. There, when you talk of mental illnesses, they start attaching a meaning of either spirituality in it or religion. They just don't understand the whole dynamics of mental illnesses. So awareness and more of research and more of what we're doing will at least one day send the message.
So I hear you, Khodani and Mata, you're saying that awareness about mental health is very, very important. So then why can't people just ignore it? Let's say they don't know that they have mental illnesses. So why can't they just ignore the illness and just carry on? Why should they seek treatment? Why is it important to seek treatment in this case?
Okay. Like I said, I love the fact that I mentioned this in the beginning. Can you ignore cancer?
No. It's gonna kill you.
Definitely. No, you can't. There'll be symptoms. Someone will go to the clinic, they might misdiagnose it, but it will be serious and severe and it will kill you. Same with the mental illness. Once the severity gets serious, it's one way around, it will kill you.
Yeah.
Yeah, because you'll end up in being danger to yourself or the community. You'll end up misdiagnosed. You'll end up it's really a problem, to be honest. It's really a problem, and more especially in our Black community. Some people maybe seeking professional help is something fancy, or it's not for Black people. But I believe it's very important. Same as medical conditions, you can't ignore a mental condition.
Absolutely. Wow. I like the example you give there, using cancer as an example, that mental illnesses is a medical, is similar to medical conditions. It needs treatment, it needs attention, the same way you'd give attention to cancer. I like that example. Thanks a lot for that. So maybe you guys can just give us ways in which people can care for their mental health, the same way you should care for 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 your skin. We need to care for our bodies. We need to care for our in general. How can we care for their mental health?
This is my slogan. Perhaps talking about what bothers us is all the help we need. Perhaps talking about what bothers us is all the help we need. So if there's something bothering you, don't bottle it. Talk about it. Why is it bothering you? If you're having a tummy ache and you go to the doctor, so same with psychology. If you're having a problem that's bothering you, go seek professional help. You are, as much as you're saying that you are healthy physically, you need to be healthy also psychologically.
Mentally, psychologically, true. That's
Yeah.
Are there places where people can get help? What are these people called? I know clinical psychologists. We're going to talk a bit about your practice now, but are there obvious places now in South Africa that people can maybe go to for just to talk, like you indicated? Do you have any examples, any ideas?
Yes, there are actually NGOs that offer mental health care. For example, there's SADAG. The SADAG is an NGO whereby people go there and volunteer as counselors, and they give help to people who are more especially with trauma, child abuse, and just if you want to talk about anything, you can just give them a call, and it's for free. And there's also Lifeline; it's also for free as well.
Wow, I like that. I actually put that on the screen here so that everyone can have that. I also just link them in the description box. Thanks for sharing that. Khodani, do you want to add more on that?
Yeah. Thank you for mentioning SADAG, Martha. Everywhere there are counselors. I'm lucky enough because I also work with EAPs, employee wellness programs. Where at your workplace there are counselors, or maybe you don't know this. That's an NGO. Well, people are trained to become counselors. There are social workers as well in every clinic, even community clinics or hospitals. There are social workers who are counseling as well. So psychologists come in more when there's an identified pathology.
Yeah.
Where we need to diagnose, assess, and also admit possibly. That's where clinical psychologists get. But start like the starting point, just what Martha said. SADAG, Love Life, clinics, social workers, even your family member. Don't take this lightly. If someone wants to talk to them your ear, you are also a counselor. But then honestly, you need to talk to someone, talk to a friend, talk to a teacher, someone that you can trust. Then they will also seek help for you.
That's true.
Don't allow it to bottle you. If something is bottling up, it will explode eventually.
That's true. And the earlier you really say it, the better, like you said, because at that stage it's still light and it doesn't affect you a lot because your body can only take so much. Your mind can only take so much. So the sooner you express it, the better.
Can I just add that I remember a patient of mine told me something of which I learned something from him.
Yeah.
He said it's better to cross the river when it's still too low.
Right.
Don't own it, because once it gets to your waist, you'll be like, I know I can still swim. But once it gets to your shoulder, you're just gonna sink in.
Yeah.
That's it.
You're gonna drown. Absolutely. Wow. This is amazing. While I still have you, Khodani, before I go to Khodani, I want to talk a little bit about Khodani's practice. But Martha, do you want to add anything now, or is that fine? Can we just hear more about Khodani's practice?
Actually, I would like to add something about the prevention of mental health. Okay, just add a little bit there. I think we haven't touched.
Sure.
Okay, so the prevention of mental health, I think if we can have more of this, as Khodani already mentioned, that this is awareness that we're doing here right now, but if we can just have more of this mental health awareness, and then people can actually talk about their experiences if they are brave enough to do so that others can learn that it is okay to talk about your problems and it is okay to get help for you.
Khodani, I understand you have a practice that you are running, which is really great. The one that I mentioned earlier on, which is a clinical psychologist practice. Do you want to share a little bit about this. How can people make use of the services that you offer? You can share the services you offer and how people can get hold of you for those who are watching and like to use your practice.
Okay, let me not talk about my practice only. Let me start first with the hospital in general is free of charge. The admin part of it, where you have to first open a file, then get a referral to come see a psychologist. I'm the head of department in the Far Eastland Hospital, psychology department. So we do see people every day. Then from here, I also have my practice. It's KTL private practice in Benoni, Guatemala, and also Dalview. So any medical that I offer services from assessment, be it personality assessment, emotional assessment, IQ assessment, forensic assessments.
Oh, wow.
And also offer therapy to any individuals, from children to adults, also to tired people, be it social problems from bereavement, depression, bipolar, insert therapy,
Oh, wow. It's very
couple therapy, family therapy.
It's very detailed. What I will do is I'll share your details. Can you just share with us the details, like if someone wants to use it? Do you also do online consultation as well? Let's say someone is watching and they're in the US or they're here in Cape Town and you are in Benoni. Do you also do online consultations as well?
Definitely. I mean, COVID is with us now, so online is the way to go. So KTL Private Practice, www.ktlprivatepractice.co.za. That's where you'll find me. For further reading as well, I've got a master study in exercise. Is only focusing on students because that's where students with different backgrounds, different beliefs, cultural diversity, and everything in the meet, and then also when they're met with social academic demands, they are prone to depression. And so my study proved that exercise actually minimizes the symptoms of anxiety and depression. And also my doctoral thesis was focused on the elements, but now looking at the University of Venda, which is a previously disadvantaged community.
Oh, wow. Martha and Khodani, you guys were amazing. This has been very enlightening, I must say. So thank you so much for joining me and being willing to be part of the change. As Khodani indicated, that a lot of people in South Africa are not aware. They don't even know what mental health is, and so talking about it is important. And as you also clearly indicated, Martha, so you guys were amazing. I appreciate your time, and if anybody has any thoughts or any comments or questions for Khodani and Martha, I'm sure you guys wouldn't mind answering questions that are coming here on YouTube from people about mental health. So feel free to leave a comment in the comment section below, and they will be happy to answer your questions. And awareness is key, like they indicated. So if you enjoyed our conversations, please give this video a thumbs up. Thank you so much, guys.
Thank
Bye-bye.
you.
Cheers.
Bye.
Bye.